So, Dr. Maddie, tell everyone a little bit about yourself. Where did you go to school? When did you graduate? How long have you worked here?
I graduated from Quinnipiac University in Hamden, Connecticut. I graduated this past fall of 2025, and then took my boards in the summer and then started working here in January.
When you were getting ready to graduate, what kinds of things were you looking for in your first job out of school?
I wanted a place that, one, had the true mentorship that I was looking for, somewhere that was going to feel supported, and also somewhere that I was going to feel challenged in my clinical skills.
Excellent. What were some of the important factors that influenced your decision when evaluating, other job opportunities, not just ours?
When I was evaluating, the thing that just kept showing up was the mentorship and the support that I would get from a specific clinic that I was going to be working at. That's like the biggest thing that stood out at CJ Physical Therapy and Pilates, on top of also their patient care model that was vastly different than anywhere else that I looked at.
Yeah. Every Tuesday we close for about 3 hours and do training on tough cases, which is pretty fun.
Yeah, it's the best.
During the interview process, what stood out the most and made you think, this place feels different than some of the other places?
So I have an interview with Carrie and Jen, our operations manager. I think what stood out most about that interview specifically was I could just get a sense of how close Jen and Carrie were and how supportive they work as a team. It felt, even like walking into the clinic, it felt less of a workplace where people are just there to kind of do their job and do what needs to get done. Everyone was excited to be there. They were both extremely passionate about what they were doing, and they also were asking questions that I didn't get in other places. So they were asking questions about what I personally wanted and what I was looking for, what would make me feel seen and heard, which I really appreciated.
Before accepting this position, obviously we're a cash-based practice. We have a different business model than the insurance-based practice. What questions or concerns did you have about working in a model like that?
I was kind of just, let's go in open-minded and kind of see what they have to say, see what their experiences have been like in this cash-based model. And honestly, after the interview, I just kind of trusted what Carrie and Jen had to offer and what they had to say. But I would say my biggest concern coming out of school as a new grad was, would I be prepared? Would I be prepared to have these difficult conversations with clients about going out of network?
What has surprised you most about working here compared to what you thought it might be like?
What surprised me most is just like the culture and the energy of this clinic. Every client that walks in the door, we know so much about them. They're like very personal relationships. We every interaction that we have with them is important. We get to see them one-on-one for a full hour. It's just made me grow so much as a clinician, because I'm not just rushing to get something done, get what I need out of the session. I'm truly having the time and also having the training time with Carrie and the other clinicians that work here to make sure that we're getting the results that we need.
Tell us a little bit about how your confidence as a clinician has changed since your first day to now.
Day one, I was walking in very nervous, as many of our new grads are. You just don't know what to expect. But very quickly, one of the things that I just briefly touched upon, like the support, the culture, and the mentorship. Day one, week one, I finished and I was just like, this is where I'm supposed to be. And I felt so supported. Even when I was having days where you get some of that imposter syndrome, you don't know if you're doing something right or if you're doing something wrong. I always had someone to lean to and someone to ask those hard questions to.
What role has the mentorship on our Tuesday team trainings played in your growth?
It's been huge. I mean, every week we get a full, 3 hours of training with Carrie herself and then the other clinicians that work here. Carrie's been doing this for a really long time. She always reminds us of that. So she's seen it all. And I am just so grateful that I feel confident and comfortable asking her questions whenever something does come up. So whenever I've had a difficult conversation with a client, or maybe their plan of care isn't going exactly how I want it to go, or they are experiencing something that's been tricky, I always know that there's someone that I can go to every Tuesday to get my questions answered.
What makes you feel confident that you made the right decision for your very first job?
Just generally the sense of every time I walk into work, every time I leave work, I'm reminded that I made the right decision. I'm not feeling burnt out. That was like the thing that I had everyone in my ear concerned about. PTs are gonna get burnt out of their first job. They're gonna feel tired. But every day, I mean, I'm seeing the amount of clients that I see one-on-one for an hour, and I feel like success at the end of each session, and I feel like I've fulfilled my needs each day. And I'm not going home like fully exhausted. I always feel like there's someone to talk to and someone that has my back.
What would you say to another new grad PT who is considering applying here for our open position?
I would say go for it. Don't be scared. I mean, there's going to be those first day jitter nerves, of course. I experienced them. I'm still only been here 6 months. There's still clients, there's still days where I'm like, am I doing this right? But there's going to be like that throughout your whole career. And I would say take the leap of faith. It's all going to be worth it in the end.
And one sentence, why should a PT consider a career here at CJ Physical Therapy and Pilates?
The mentorship, the support you feel every day, it's unlike any other experience that I've heard from other PTs. And even throughout the interview process when I was going through this, it's vastly different. I feel supported every day. I feel valued, and the patients can see that. I'm not showing up to their sessions dragged down and things like that. I'm ready to go every single day, and I think it shows kind of in their success stories.